Today I want to review some muscle work that we do with a lot of our hip clients, and additional to some joint work that we do. First is for the psoas, prime mover of the hip and back. What we do is expose the stomach, gently bring your hand and your fingers onto the stomach. The lower portion, we're at about lumbar 4, so we're going to trace it from anywhere between lumbar 1 and 2 all the way down to the pelvis. What we do is just gently soft sink into the hip muscle, into that psoas, find the tension in that area, and gently glide the knee back and forth as we do the deep tissue release. I want to make sure we have good play or an ability for that tissue to glide from side to side. And we go from the medial aspect to the lateral, and we also will trace from lateral to medial. Now this muscle traverses all the way through the lumbar and pelvis, so we want to make sure we treat all the way down to the anterior aspect of the inguinal fossa. Another thing we can do, the inguinal ligament. Another thing we can do is treat the iliacus, which is a muscle on the outside that joins up with the psoas, making sure that that muscle is gliding very nicely and easily. The next muscle group or soft tissue area we will work on is the muscles around the inguinal ligament. Very important, these muscles get very restricted, and the ligament gets very restricted in this spot of the hip. So we just gently glide that so the muscle tissue and ligaments can fold or bend. It oftentimes gets very tight and adhered. So we want to go above that inguinal ligament and below that inguinal ligament just to get the tissue to react more freely. Next we'll go on to the front muscle, the rectus. Again, just peeling it away, so see if that muscle can fold, get out of the way. We want those muscles to lengthen and fold while we're using them in functional positions. Just take your time, free up that tissue. Once you find a nice little restriction, just hold that pressure. You could rotate your fingers just a little bit to lock in the restriction and just let that melt. And as it melts, you could also move that hip along a little bit to allow that tissue to free up and become more mobile, more active, and less painful. Next muscle group is the adductor group. What I want to do is focus our attention at the pubic symphysis all the way up as the muscles attach onto this bony prominence. I'll go a little bit above to just check the obturator, make sure that that muscle is freed up, and we'll just do a slow, gentle release. We'll go just inferior to the pubic symphysis, the pubic rami, and just gently find these restrictions of the adductors and just give direct pressure, finding the most significant restriction and letting the muscle just release as we give it pressure and time. After that releases, we could go ahead and trace the whole muscle down to the knee, finding any significant restrictions and giving direct pressure or direct technique, helping it out with the other hand or assisting hand to get the pressure to release off the adductor group and allow the hip to function more freely.